Griffin Hospital is a community teaching hospital that serves the lower Naugatuck Valley.
I think Griffin's impact in the community can be seen in one word, and that's results.
Griffin has been very progressive and a leader in the patient-centered care movement, and as a result, I think we've created something unique here.
You walk through the front door of Griffin, you do not feel like you're walking into a hospital. As soon as you walk in, you see somebody smiling, you hear some music. Even walking in the parking lot, you hear nice background music. I think that we're very unique through the Planetree philosophy.
So one of the things I love most about the Planetree concept is that everybody's a caregiver. It's not just the nurses or the doctors or those at the bedside. It's really a soup to nuts experience from the time you walk through the door to after you walk out.
The caregivers, I thought, were fantastic. They sat down with me and explained to me what was going on with my body, the new medications, what to expect, what to look out for, any side effects, what I should do when I go home to make sure that I don't have to come back here again.
And I really do believe that it is unique not only in Connecticut but in the nation in terms of what we have been able to accomplish concerning keeping the patient first, as well as maintaining superb quality and attention to our patients.
I have breast cancer, stage 2. I did my radiation here at the Cancer Center at Griffin Hospital, and it was a wonderful experience. My first day I was a nervous wreck, and the girls just did nothing but try and comfort me. I got hugs. They were really very calming. They said, you don't have to worry about a thing, and we're right here for you. And if you have any questions, just ask us. You know, we can answer them for you, and if we can't, we're going to get the answers for you. I've gone for different kinds of treatments of other things, and you know, this means a lot in a place where you receive your major treatment, and cancer is very scary. And this does help you a lot to be in a place like this.
We offer an environment that's exceptional and is truly a healing environment. We offer an exceptional patient experience. We're producing wonderful clinical outcomes. And as a result, not only are we attracting more consumers to use Griffin services, but we're attracting physicians. We just were able to attract literally a sort of world-class microvascular reconstructive surgeon who just finished his training at Johns Hopkins. So we've made a number of significant investments in new clinical capability just in the last 2 years. One of those investments allows us to do state-of-the-art neurosurgery, either on the spine or on the brain. Griffin, as a result of having this technology, which is very rare, it's only available in 1 or 2 other hospitals throughout the state of Connecticut, is attracting neurosurgeons from all over the region. It's been a true partnership between the community, the hospital, and now physicians with these very special skills that we've been able to attract to Griffin. We have unique capabilities. We have the only preventive medicine training program in the state. We were an innovator and created a combined preventive medicine, internal medicine training program, the first in the country. We're the only community hospital with a federally funded prevention research center. We're going to capitalize on that. The whole industry is moving toward where Griffin is. Our whole industry has been focused and rewarded for taking care of sick people. That is changing. The new incentives will reward the value hospitals that can lower cost and produce exceptional outcomes. And Griffin has this unique advantage. We've been a value hospital, but we've been in an environment that doesn't necessarily reward that. And we've positioned ourselves sort of ahead of the curve, but now we will be rewarded, and the rest of the industry is running to catch up. And frankly, that's exactly where we want to be. in an environment where you get paid to take care of sick people, nobody was rewarding you to go out and keep your community healthy. Despite that, Griffin was doing it. As we build our core capability and attract new physicians with new capabilities, they all require investment in terms of program development, new facilities, new equipment. That's never going to go away. And there's never enough money generated from the operation, so we're reliant on the community for support in the form of philanthropy to make those investments.
We became aware of Griffin's plans to build a cancer center several years back, and we were approached by them and asked if we would consider giving a grant. And that's really where the relationship began. We are thrilled with the work that Griffin's doing. What they've accomplished in the past few years, just building the cancer center, the breast wellness center, and their future plans that they're now talking about with the interventional radiology. I think the thing about us donating to Griffin and why we're so thrilled to be a part of it is that we see these results. You're not wondering where your money's going. You're not wondering what your money's doing. You see concrete results. It's there in front of you, and you just see the hospital growing by leaps and bounds. I would highly recommend donating money, whether it's $100 or it's $100,000. Whatever you can give to Griffin, it's going to be well spent.
Imagine what life would be without Griffin Hospital. It is a resource that is remarkable to have in this little community. And right now, we need their support.
It's now rated as top quality, low cost, and it's one of the only hospitals around like that. It's the perfect place to donate.
We're trying to enhance our services, bring new services to the community, and we can't do it alone. So we need community support to continue to provide our residents the highest quality care we can, state-of-the-art facilities, first-rate physicians, in a setting that is incomparable to anywhere else.
We will continue our leadership position and we'll capitalize on the strengths, the inherent strengths of this organization.